You are watching COVID updates on Voice of Canada, and this is Sana Haru. With our state seeing a resurgence of COVID-19 cases, U.S. health officials are trying desperately to boost low vaccination rates in some parts in the country.
It took less than a month for Los Angeles to go from success story to cautionary tale. With the Delta variant surging rapidly, a mask mandate is coming back.
This daily increase in cases to the high level where we are now puts us in the category of substantial community transmission.
All 50 states are now seeing an increase in cases, a surge driven by the unvaccinated. In Las Vegas, masks are once again recommended for everyone. In Mississippi, those over age 65, the most vulnerable, are being told to avoid gatherings indoors regardless of vaccination status. 99% of hospitalizations and deaths are among those who've avoided inoculation. In areas with low rates of vaccination, the virus is surging fastest. Breakthrough cases, though typically mild, are being reported in larger numbers among the fully vaccinated, too.
Our vaccines work. They work for what they were intended to work. They prevent us from dying, prevent us from being in the hospital.
In a country with easy access to vaccines, there's still substantial reluctance. Only 48% of the population is fully vaccinated. The White House blames an epidemic of misinformation. More will surely follow. Amidst the renewed surge in cases, hospitals are filling up again, and deaths have started to increase.
Prime Minister Justin Trudeau is dropping hints about reopening Canada's borders to foreigners fully vaccinated against COVID-19. Those from the US may be able to visit Canada in a month's time, followed by others inoculated internationals by early September.
It was an absolute source of heartbreak that they missed his entire babyhood.
Mireille Leger is a Canadian living in the U.S., and there's been no help for families like hers to reunite with grandparents, with two boys too young to be vaccinated and therefore forced to quarantine.
This is very frustrating. You know, my husband and I were both vaccinated. The entire community where we are, we're all immunized. The COVID rates are extremely low.
While all 50 states are seeing an increase in COVID cases, blanket border rules are baffling many. The government now signaling it will open the border to fully vaccinated Americans in mid-August and fully vaccinated travelers from everywhere else by early September. The Prime Minister and Premiers discussed the plan Thursday night, including concerns border services will have enough resources to process a surge. There are many details yet to be announced, including the mechanics around an international vaccine passport.
Even if there isn't an overall plan, let's make sure there's a plan to implement this announcement, because at the end of the day, policy without execution is just policy. It's not action. That I think is key, because it will build confidence.
More people continue to get vaccinated against COVID-19, with about 80% of those eligible having received one dose and approximately 56% of those 12 and older fully vaccinated.
21-year-old Tori Pereno knows the best way to reach her generation is
through social media.
So it was a no-brainer for her to use the power of her platforms to spread awareness about the COVID-19 vaccine, teaming up with a gaming company in a campaign called LG I Got the Shot.
And we got close to 5.5 million people to pay attention to the campaign.
Public health experts say vaccinating young adults is essential to keeping infection numbers low. In the U.S., just 42% of 18 to 24-year-olds have been fully vaccinated, compared to 60% of all adults. In Canada, in part to delayed vaccine rollouts, the numbers are currently even lower, with just under 30% of ages 18 to 29 double-dosed. And if that doesn't work, star power can be influential too.
I'm in awe of the work President Biden and Dr. Fauci have done, and was happy to help lend my support to this important initiative.
That's 18-year-old pop star Olivia Rodrigo promoting vaccination at the White House this week. Pereno supports that kind of PSA, but says mostly her generation is just looking for clear facts.
Based off of how everyone sees it, it kind of seems like a lot of them are overwhelmed with the amount of information.
Hoping to use her reach to spread information responsibly and influence others to do their part to end the pandemic.
Lots of Canadians have already had their second shot but may still haven't, either because they are waiting their turn or choosing not to get it.
Lots of Canadians have already had their second shot, but many still haven't, either because they're waiting their turn or choosing not to get it. Etiquette expert Julie Blake-Como says whatever the vaccine status may be, we should be mindful before asking about it.
Consider the context. Is this a business context? Is it a social context? Am I friend or foe?
If you're on friendly terms, Blake-Como recommends figuring out your motivation.
Are we asking a question out of curiosity, or is it care, concern, being cautious? If it's out of curiosity, probably best not to ask.
But if you're asking out of concern,
the safest way is always to volunteer your status. Observe after that and then decide if you're going to ask the question.
She recommends avoiding questions around vaccine brands, since not everyone has had the luxury of picking their shot. Lots of Canadians were able to get the jab early due to their health condition, age, or postal code. Blake-Como says avoid asking how someone got their shot before you.
What you want is your friend, your family member, your colleagues, your clients to be safe. And what's going to be the point of that question?
But if you're hosting a social gathering or sending your kids for a play date, it's fine to ask about vaccine status, respectfully.
You're going to state your position. We will be hosting people that are vaccinated. Your house, your home, your event, your rules. Our family has decided that our children, for the time being, would go on play dates with other children's families that have been vaccinated.
But if a friend, family member, or close colleague doesn't want the shot, you can ask if you're doing it out of care.
I care about you, and from what I do know, vaccination is best for your health. Whatever your decision is, I respect it. So you're not there to preach. You're not there to shame, to embarrass.
And finally, Blake-Como recommends carrying empathy instead of curiosity as we wait to build herd immunity.
The United States is seeing a dangerous resurgence of COVID-19 across all 50 states as infections and hospitalizations surge, mostly among Americans who have not had a vaccine.
According to Oxford University's Our World in Data, 49% of Canadians have received both doses of a COVID-19 vaccine. In the U.S., it's 48%. When it comes to the first dose, it's 70% overall in Canada, compared to 55% in the U.S.
Masks are back on in Los Angeles County, mandated after a new surge of COVID-19 cases.
Until things really get back to normal, got to do what we got to do to get things back to normal, you know what I mean?
New cases of COVID-19 have doubled in the U.S. in the last 2 weeks, rising in almost every state as the Delta variant spreads. Officials in L.A. are taking no chances. Hospitalizations for COVID-19 are also increasing in several states, up more than 70% in Florida and 150% in Springfield, Missouri, which is now running out of hospital beds. In Nevada, nearly 100% of the people in this hospital's intensive care unit are unvaccinated.
With some of these variants, it's passing much more efficiently, and people are getting much sicker than last year.
Health experts expect more mask mandates will be put in place as hospitals become overwhelmed again. Warning this fourth surge is just the beginning. The Centers for Disease Control is urging everyone to get vaccinated. President Joe Biden is even taking on Facebook, accusing the social media giant of spreading vaccine misinformation.
They're killing people.
Facebook is firing back, saying millions have used their vaccine finder to get a shot. The battle comes as federal health officials struggle to put an end to this pandemic.
As the stock market grapples with fears of the COVID-19 Delta variant could harm economic recovery, a survey found that nearly half of Canadians can't cover living expenses this year without going deeper into debt.
On a day when stock markets sold off on fears the coronavirus Delta variant could harm the economic recovery, a new survey found nearly half of Canadians say they can't cover living expenses this year without going deeper into debt. According to MNP's Consumer Debt Index, 35% of respondents say the pandemic worsened their family's debt, 1 in 3 report being house poor. Bankruptcy experts say government supports have slowed a looming economic reckoning, but are predicting a gradual pickup in insolvencies this fall and winter as financial pressures build, warning the current grace period won't last.
One of the big wild cards right now is that Canada Revenue Agency is not doing any hardcore collecting. They're sending out letters, they're making phone calls, but I haven't seen them being aggressive with wage garnishments, requirement to pay notices, liens on houses, that sort of thing.
But a reopening of the economy will bring back financial problems that existed before the pandemic, along with those that snowballed because of it.
A new national study is looking at how well COVID-19 vaccines work in vulnerable and immunocompromised Canadians.
Chantel White has common variable immune deficiency. Her immune system is so weak, she relies on regular injections of donated plasma to fight off infections.
They take out the immunoglobulins, which is the antibodies from that, and then I give it to myself. And so I get kind of the immunity of the general population.
And while the mother of two has had her COVID-19 shots, doctors have no idea how much protection the vaccine actually gave her. Chantel is part of a new national study.
We're trying to determine what's called vaccine immunogenicity, which is, does the vaccine create an immune response?
Dr. Michael Chu's team is focusing on blood cancer patients, a group especially vulnerable to COVID-19.
Their disease makes them more immune suppressed, initially just because it is an immune system cancer. But number two, their chemotherapy particularly targets the immune system.
Early data shows just 10 to 20% of myeloma patients develop immunity after COVID vaccines. But Dr. Chu points out that's based on antibody levels.
I'm also hoping that the T cells are actually still very functional. So even if they aren't producing antibodies, maybe those numbers are actually pessimistic. Maybe a lot more of these people are actually doing better than we think they are.
The goal is to collect information and come up with strategies for immunization.
So we may learn that certain populations require extra doses of vaccines to create a sustained immune response.
Timing during cancer treatment could also be important, or vaccines could be tailored for a specific group, hoping to learn how to protect herself and others.
I feel like this isn't the last time that a new virus is going to come out. And the more we know now, the better we'll be able to handle it in the future.
British Prime Minister Boris Johnson is self-isolated due to another potential exposure to COVID-19 after Health Secretary Sajid Javid tested positive for the virus.
They call it Freedom Day, Great Britain's great experiment. No more social distancing and mask requirements. Even nightclubs can fully reopen.
If we don't do it now, we've got to ask ourselves, when will we ever do it?
The move is being sharply criticized by public health experts in Britain and in Canada.
It's a complete mistake. What they're doing there is so absolutely not informed by science and by data. It's actually outrageous.
Some British doctors are worried because case numbers are rapidly climbing. There were more than 50,000 on Saturday, the highest daily number in 6 months.
It'll almost certainly get to 100,000 cases a day. The real question is, do we get to double that or even higher? And that's where the crystal ball starts to fail.
I just wanted to update you all that I've tested positive for COVID.
The British Health Secretary is now in quarantine, and so is his boss, Prime Minister Boris Johnson, a day before rules are rolled back.
I've been pinged, I've been asked to.
But that healthcare system may face a new test, one even larger than before.
They will have reached the same ICU occupancy as they had during the last wave by mid-September.
Dr. Peter Juni says the lessons for Canada are clear.
We should not gamble with this good spot that we're in right now.
In Ontario, which just allowed gyms and movie theaters to reopen and indoor dining to resume, mask mandates are staying in place for the moment, even though other provinces like Alberta have dropped those requirements. 2/3 of Britons have received 2 doses of vaccine. Whether in England or Canada, Dr. Juni says the focus has to remain on vaccinations.
Then unvaccinated people that drive the pandemic again and hold everybody else back, but also put people at risk who are already vaccinated.
Please, please, please.
The Prime Minister is urging British people to get their shots, and he says to be cautious as the country leaves COVID-19 safety up to individuals.
Keep watching COVID updates on Voice of Canada. For further updates, visit our website, voiceofcanada.tv.